Continuing our health conversation this morning, you may have noticed recently that a lot of celebrities have come out to talk about dealing with endometriosis. We brought in Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology to discuss what is endometriosis. Sure. How do you distinguish between what would be traditional menstrual pain and knowing that you've really got a problem that you need to seek some help from the doctor?
Sure. First, I want to say thank you for having me and thanks for dealing with this important topic. The more that we can cover these issues, the better women are able to take care of themselves. So endometriosis is a byproduct of what I call a woman's superpower, her ability to grow a baby in her body. And so every month in her cycle, a woman does two things. Her ovaries make cysts, that one of which will become the cyst for that month. And if it meets its sperm, she can get pregnant. The other part of it is that the cells lining her uterus grow into a nice thick lining that can nourish that embryo. If she does not get pregnant, she sheds that lining. That's her period. Right? Endometriosis is where those cells lining the uterus grow outside the uterus. They can grow on the ovaries, on the bladder, on the bowel, and that's where problems can come in.
I have a very close friend who has struggled with this for years, and as I understand it, I mean, it's almost like a monster taking over your body. I mean, it can grow into so many areas that are unexpected and cause tremendous pain and discomfort.
You're exactly right. The main symptom of endometriosis is pain. The good news is that many women who have it never have any symptoms. And the most women who have pain can be treated. We have multiple ways of treating endometriosis where a woman can live a very satisfying, pain-free life.
What are the options when you have had a diagnosis of endometriosis?
Sure. So, as I mentioned, there are many treatments, one of which is pain medicine. So some women will get relief just from using over-the-counter pain medicines. But most of the medicines that we use to treat endometriosis dial down the hormone system. The birth control pill, the birth control injection, and even recent studies have shown the IUD that contains progesterone can treat endometriosis for many women. So there are many options for women.
And you're listing some of the symptoms too. I mean, these are tremendous things to be dealing with all the time.
Untreated endometriosis can be quite a severe disease. However, the good news is most women can find a treatment that works for them.
As I understand it, it can impact fertility as well.
It can. 20 to 30% of women with endometriosis will have problems getting pregnant. But there's good news there too. Most of those women with treatment can go on to have the number of children that they want.
So if a young woman, say in their early 20s, who's not necessarily thinking about having children yet, is diagnosed with endometriosis, is there a conversation that should happen with their doctor about maybe planning ahead?
I like to have that conversation with all women about planning for children. If a young woman is diagnosed, her major concern if she's not planning for pregnancy is treatment so that she can live a fulfilling life that's pain-free. And when she's ready for children, to come to her doctor and have that conversation.
Quick reminder, doctor, how often should we be seeing our doctor? I know it's so easy, especially as women, especially as moms. We get so busy and we're doing appointments for everybody but ourselves.
That is a great question, and it actually comes up a lot. With changes in the guidelines for how we screen for various diseases, women are often asking, and in fact, I was writing a blog post last night, doctor, should I come back next year? And yes, you should. Because there's so much to go over with your doctor, symptoms that may arise, new medications, surgeries you may have had in the last year, so that your relationship with your doctor is really an ongoing conversation and not just a pop-in every 5 years and you don't know one another.
Is endometriosis something that a woman grows out of? Is it just for a particular stage in life, or is this a lifelong prognosis?
A woman can be symptomatic any time during her reproductive years. Endometriosis tends to wane with menopause. But again, it can be treated so that the symptoms aren't too problematic.
Well, where do we find you if someone's looking for a doctor? It's always hard to make that connection.
Absolutely. Finding a doctor that you can trust is a challenge. We are at 10th Street in McDowell at Central Phoenix OBGYN in the beautiful historic Grinnell building.
Oh, nice. Well, thank you very much. It's not a conversation that we have very often, so it's an interesting perspective, and it's always important to encourage, especially our ladies out there, to go and ask their questions.
I appreciate you having me.
Thank you, Dr. Thompson.